Thank God is fabulous.
Male nurses.
Patient comfort, values, and beliefs.
Thank God is fabulous.
What is cancer? What is your perception of cancer?
Well, today our guest will be sharing her story on living with cancer.
Thank God is fabulous.
Friendship. What is a true friend? He's my friend. She's my friend. Can a male and a female be true friends?
What are the benefits of friendship? Are there true friends with benefits or not? How do you know somebody is a friend? What are the criteria? What are the requirements to have a friend?
Thank God is fabulous. Well, today we are going to be talking about career choices.
Do you make career choices based on your habits, or things you love, or what's trending, or what would be your livelihood?
Is it going to be vocational, or is it going to be higher education? What's your choice?
Good evening, good evening, good
Good
evening.
evening. Good evening.
Welcome to another episode of Thank God is Fabulous.
Yes, indeed.
Well, today we're going to be discussing diabetes. And we're going to have Jeremiah Saleh on the show today to talk to us about diabetes and some medications. So, some things you've heard about that you're not sure about. Well, today you can ask some questions. You can call in to put it to rest. Okay?
Oh, yes. We are having the infamous scientist, Mr. Jeremiah Saleh,
Hello.
is going to come in and talk to us about diabetes and
Okay, I'll send you the link.
just shed light on it and the treatment of it.
Oh.
So please have all of your questions ready. You can post your questions or you can call in with your questions.
Yep.
You know, I was reading up on diabetes, and I mean it affects over 37 million people.
Mhm.
That is a lot.
But see, and the sad thing about it is that it's sneaky.
Very sneaky, yes. Very, very sneaky.
It
And then
sneaks up on you.
it does, you know. And pre-diabetes, which is when your sugar level is, you know, is not where they've diagnosed you with diabetes, but it is high enough where you are at risk of developing diabetes.
Yeah.
That affects over 90 million people. Can you imagine?
Because everything they make for us anymore, they put
sugar.
High fructose corn syrup, some
Yes.
sugar in there, trying to entice our taste bud. And the more you fall into that category of wanting to satisfy your sweet tooth, well, pray that you got a lot of beta cells to be able to create them insulins.
Exactly.
Yeah. But you know what? New studies have come up though, stating that it's not because you eat sugar that's what gave you diabetes.
True. So true.
God, the big thing, what people say, sugar disease, sugar disease, sugar disease.
my sugar.
Yeah. So it made it look like once you eat sweet, you're gonna get diabetes. But that's not how it works. If you're eating sweet and you're burning it as energy, it can't store up. But when you're eating sweet and it's storing up, now you're looking for your own trouble. So if you got high metabolism and you're eating sweet, you won't even know what's going on. Because your body will be able to burn it and get rid of it. But if you're just eating it and it's just sitting in your body and you're not using it, then you're looking for trouble because it flows in the blood. And wherever the blood goes, the sugar is going to come. And they are very good at forming roadblocks to get to your little capillaries. They will form roadblock and nothing can go beyond the point of the roadblock. And at the end of the day, you start to get sensations, tingling, numbness in your extremities, and it starts to work its way up.
Because it damages your nerves, you know? So.
Yeah. Wherever the blood vessel is and blood is flowing, it will get in that track and follow the line. Yep.
And then during the second half of the show, we are going to have one of our own in the community, Mr. James Gawolo. He is going to come on and shed light on what is going on with him. And he also needs some assistance from the community.
Yeah.
So hopefully the organization LAI will come in and, you know, give some assistance, whatever assistance we can render to him. You know, we can rally around him and render that. But we will let him come in and, you know, tell us what's going on.
Did you send him the link also?
I just did, yes.
Okay, good.
I just did.
Because, you know, we are all in a foreign land and this is not our home. Even though as Liberian we could to get comfortable and settle down and make it feel like home, we are not home. So it's always good to look out for each other. You never know.
Yeah, so while we're waiting, I'll just go through some myths about diabetes. And this is taken from the American Diabetes Association. So this is evidence-based. So the first question is, if you are overweight, will you always develop type 2 diabetes? And the answer is, being overweight is a risk factor for developing diabetes. But other risk factors such as how much physical activities you get, family history, ethnicity, the age also plays a role.
Yep.
Unfortunately, many people think that weight is the only risk factor of type 2 diabetes, but many people with type 2 diabetes are at a normal weight or only moderately overweight. So,
Yep.
Being overweight, yes, it is a risk factor, but it doesn't necessarily mean that you will always develop diabetes.
Yep. So true.
There are other factors that plays a role. And
so
then,
we have Mr. Sele in studio now.
is the studio? Okay.
Yes. We'll go ahead and bring him on so he can introduce himself and then take it away.
All right. I'm going to share while he's coming on.
Welcome, Jeremiah. Thank you for being on the show today.
Hey, how are you? How you guys doing?
We are fine.
We are
We are
fine. Thank
excited.
you. Yes.
Are you hearing me clearly?
Loud
Very
and clear.
crystal clear.
All right, thank you.
Yes.
So,
So,
just
go
to let
on.
you guys know, I don't know how to share my screen. So,
Okay.
yeah,
It's okay.
It's okay.
okay.
So, before we start, Jeremiah, can you introduce yourself to the audience? And for those that are watching, can you please share?
Are you guys seeing me? Because a little bit on my screen.
Yes, we are.
Yeah, we can see you.
Okay. So, sorry. So, by means of introduction, I am Jeremiah Kisele Senior. I am a Liberian residing in Indiana here, and I just like to contribute sometimes to our community, especially in terms of what our sister Sis Fasia and Madam Piri is doing to create this educational awareness. And I feel that I can be part of it and I can help to contribute a little bit what I know. We don't know everything. Let's just make that very clear that we could make errors because of some of these studies. Sometimes it's normally updated, and these updates are through guidelines and reviews and research studies.
Yep.
So having said that, I say I'm Jeremiah Sele. I won't go into extra portfolio of myself. So I'm just Jeremiah Sele, and maybe from my expose on the topic and stuff like that, we can connect. Thank you very much.
All right. Thank you so much, Jeremiah, because there are a lot of things about diabetes that a lot of people are not aware of. And we are so happy today you want to share light so that a lot of people can get some understanding, because we were just talking about it. Diabetes is sneaky. Before you know what's going on, it's upon you. And knowledge is power. The Bible said, my people perish because of the lack of knowledge.
Yes.
So today we want to
Absolutely.
put some things to rest, especially with rice-eating people, so we can try to
true.
understand ourselves. I'm telling you, carbohydrates will get you. So Jeremiah, please educate us about diabetes.
So I have an issue with my computer here. Just give me the meaning.
Okay.
You guys can be talking.
Okay.
Okay, so while he's
Internet.
getting his computer set up, we will go with the second myth
Wow.
Second myth.
of diabetes. and that was the one we talked about when we started. It said, do sugar drinks cause diabetes? And again, these answers are from the American Diabetes Association, ADA. And the answer is, research has also shown that drinking sugary drinks is linked to type 2 diabetes. The American Diabetes Association recommends that people avoid drinking sugar sweetened beverages and switch to water whenever possible to help prevent diabetes. Sugary drinks also raise blood sugar and can provide several hundred calories in just one serving, which is true.
Yeah.
Just one 12-ounce can of regular soda has about 150 calories and 40 grams of sugar,
Yep.
a type of carbohydrate carb. This is the same as 10 teaspoons of sugar. So can you just imagine if you're drinking one 12-ounce can of soda, it's like you taking 10 teaspoons of sugar and just putting it in your mouth. Wow.
Yep.
That right there just put the light bulb on.
My dear.
So some sugar sweetened beverages includes beverages like regular soda, fruit punch, fruit drinks, and those fruit drinks are really, really high in sugar.
Ooh.
Energy drinks, you know, I see college students drinking these energy drinks. It has two negative factors, okay? Number one is high in caffeine, which is not good for you. But the thing by them drinking these energy drinks, they're going to stay awake and alert. So it's high in caffeine and it is high in sugar. So number one is it's not good for your heart, the caffeine. And then the sugar, the high sugar, is not good for your system.
Yep.
And then the other drink is sports drink, sweet tea, sweetened coffee drinks, and then other sugary drinks.
It's sad.
Yes, so we have to be very, very mindful.
And you know, Fasia, that's so funny because some people drink the pop by liters.
Yes, yes.
Oh.
And
And
people
Mountain
drink.
Dew of all the pops.
That's what I was about to say.
Ooh, Jesus.
Mountain Dew is so high in sugar.
Mountain Dew is a killer.
Because
Not
I know
just
when
even
I
the
worked
sugar
when I
alone.
work night shift and I'm tired, I used to get Mountain Dew or Dr. Pepper. At least the Dr. Pepper is a little better. But Mountain Dew is all sugar. And you have people that are just, I mean, that's all they drink is Mountain Dew.
Oh yeah. Oh yeah. I have never drank Mountain Dew. I like it because I think it smells like shaving cream. Yeah, I don't know why I think it smells that way, but that's one thing that made me never touch it. Okay.
So another myth is, if you have diabetes, can you eat starchy foods such as bread, potatoes, and pasta? And so they're saying that starchy foods can be a part of a healthy meal plan, but portion size is the key.
Yep.
Always portion size is the key.
Yep.
You have to eat in moderation. If you have diabetes, you cannot go eating a full big bowl of rice. You cannot go eating a full big pan of fufu. You cannot go eating a full big pan of pounded yam.
Yep.
It has to be in moderation.
Yep. Give your body a chance to burn the food, not just put it there and can't do nothing but just run around like sugar in the blood. Jeremiah, are you ready?
Yeah, definitely. Make a readjustment to my device, so I think I should be fine.
All right, please take it away.
So, ladies and gentlemen, we're going to be on diabetes education today, and I'll be working with both hosts in studio, and we'll be basically educating ourselves and the general public. So we'll be transporting information among ourselves, and any questions that I personally can answer, since Fasia or Professor Peter can come in and try to give such assistance.
Yeah.
So let's begin about diabetes. Why we want to discuss diabetes today? Diabetes is one of those normal disease state that a lot of people have, or a lot of people carry it unknowingly, depending on that outcomes. However, it is important, and because the prevalence of the disease continue to increase, so it is important for us to discuss the disease. And the reason I would like to participate in diabetes in specification is that diabetes, a lot of our people get diabetes. When you ask them, oh, you have diabetes? Yes. Which diabetes? I don't know. My doctor say I have diabetes. What is the implications? What are the non-farm therapy? What are things you could do? Sis Farsia and the both hosts already started laying a platform. Some myth around diabetes. However, it is important for us to be aware that diabetes is a complicated state.
Yes, it is.
Therefore, we want to communicate our audience with the basic knowledge. So we are now going to dive into the complexity of, because we are all medical people here, and we're now going to dive into those terminology that we could probably use in our work settings. But we are going to be very, very extensive and be able to break down our terminology to understand diabetes. So overall today, what I have here to go over is that the basic definition of diabetes. What is this? What happening? Looking at a pathophysiology or some pathway that can cause the defects that is associated with developing the diabetes as a whole. So when we talk about pathophysiology, what is happening in your body? What is occurring at the moment? Some of the terminology we're going to look at is going to start looking at things like hormones, insulin, glucose. Those are small basic things, beta cells that our sisters already talked about, the pancreas. We are going to talk about that because when somebody say I have diabetes, they just think, oh, it's sugar. Okay, it's true. There's a sum that is sugar, but what is happening to you? Once you know the physiology of your body, it helps a lot for you to be able to follow data protocol or data recommendations. So that's the reason it's good for you to know what is happening in your body. So we're going to describe the differences of the diabetes, type 1 diabetes, type 2 diabetes, latent autoimmune diabetes, or maybe gestational gestational diabetes that's happening in pregnancy. So all of these we are going to go over there, and then we're going to look at some of the diagnostic tests. They're going to use basic diagnostic tests that you can buy over the counter or your primary physician has, and then some of the characteristics of insulin, and then it's going to basic therapy, very basic therapy, brief therapies. So let's look at what happened. Let's see what CDC announced. CDC by 2050. That's what makes it so significant. And Sis Frasia and Professor Piri, you guys can always stop me if you want to add. Don't just let me touch you off because sometimes. So according to CDC is saying that by 2050, almost 35% of the American population will have diabetes. That's a recent study. So if we have some 100% population, 35%, it's telling that almost 65% of the population will be sick. 35% is significant. It's higher. So it means that the escalation of the disease keep happening. It means keep going up. So basic background, by 2017, we have 29 million people that was affected by diabetes, which was about 9.3% of the US population. Now, if they're telling you by 2017 was just 9.3% of the population that was affected, and then by 2050, you're going to have almost 35%. That's a high growth of the disease. But 27% don't know in 2017 at the time they have the disease. And 37% of the US adults have pre-diabetic. Now, in the pre-diabetic stage, a lot of people are pre-diabetic. I could be pre-diabetic, you could be pre-diabetic, your neighbors could be pre-diabetic, your mother will be pre-diabetic, which is basically the equal state between diabetic and non-diabetic. Meaning you are right in that middle. So the approach you take could either make you better or make you worse. So a high population by 2017 were pre-diabetic. But now look at our SNP. Out of present, almost 37 million people are diabetic of present. So it's telling us that 1 in every 10 adults at this moment in the United States, 1 in every 10 adults have diabetes. That's a hard number. 1 in 5 don't know they have diabetes. They are living with it. Because when you are at a pre-diabetic stage, you don't see these symptoms we are going to talk about. So you think you are healthy. That's why regular doctor visit going to help with checkup and tell you where you are at the present moment, at which state you are at. Now, with pre-diabetes, they're telling us that 96 million people. Funny thing, 29 million in 2017. This is 2023. We already 37 million. Pre-diabetic was about 37 million. 37%. Now we are 96 million. So it's telling you that 1 in every 3 adults at least are pre-diabetic, but they don't know. Now, look at the cost of diabetes therapy. In the United States, just last year, we spent $327 billion on treatment of diabetes. So if we as a population, we as a people can manage diabetes as a whole, then it means we're going to cut down costs, we're going to live longer, and then we're going to have longer lifespan because there are a lot of complications that come with diabetes. Other comorbidities, such as cardiovascular problems, renal issues, liver issues, that we're just going to test to. Sometimes amputations. So there are a lot of risk factors, kidney failure, heart problems, everything. So what is diabetes? Let's get to the nitty gritty. Now I gave you like the historical definitions and why it is serious, because the prevalence of the disease is increasing. But what is diabetes? Diabetes is a metabolic disorder in which your body is unable, it don't have the ability to produce any or enough insulin, causing escalated level of glucose in the blood. Now, one of the whole setting, yes, glucose is sugar, but there are a lot of things that make glucose. Carbohydrate can be converted into glucose scientifically. That we're not going to dive into that, because if we dive into that, we'll be expanding the discussion, will be going out of scope. But diabetes is metabolic disorder. So your body has the inability to produce any insulin. Wow. What is insulin? Because I'm telling somebody that, oh, your body cannot produce insulin. Any person like, hey, Jeremiah, what is insulin? I don't know what is insulin. So insulin is a hormone secreted by the pancreatic beta cells. So within your pancreas, there are cells that are there. The specific cells we are looking at is the pancreatic beta cell, and that cells is there to facilitate the uptake of glucose into the skeletal muscle tissue, which is your fat tissues, increasing the number of glucose transporter. We'll get into that, how glucose is transported up. So now it just tell you, okay, you have a metabolic disorder that your body has the inability to produce insulin, so that the glucose is just stuck sitting there. Now it's telling us, okay, this insulin are within the pancreatic beta cells that can facilitate the glucose. So that's the definition. So I would like to go a little bit more into just explaining to you that process, because that process is significant enough for us to continue our further discussion. If you don't understand that process and you don't understand that complications of what happening between glucose, insulin, and the transportation to the blood, everything else I'm going to be saying is just going to go from one ear to another. So I will be specific to type 2 diabetes because it is the one most common in adults. I know most of my viewers are adults, right? So what happened? Your pancreas is an organ that sits right behind your stomach. And what happens is your pancreas can secrete so many things when you eat it. When you eat, so many things can be secreted for metabolism. So one of those hormones that is produced is the insulin we talk about. which is there to respond to high level of glucose. So, common example, I woke up this morning, I ate heavy bowl of tteokbokki. We know that, yeah, carbohydrate as a whole is in our rest, and we Liberian leg rest. Mind you, that erase the notion of sugar, because one of the myths, according to CDC, FDA, everything that sugar, no. When you eat a carbohydrate, not plenty of sugar in your rest. For one fact, we put rest and put all of the salt and all of the ingredients in our soup. But what happens is you eat it. When you absorb that, the first thing that come up is that, oh, insulin, your pancreatic beta cells say, oh, I have some meal that come in. But that meal may have glucose because of carbohydrate. Carbohydrate can be converted into sugar. So insulin, your pancreas start to produce insulin to take those glucose and transport them to other rest of the body. Take it to your skeletal muscles, your fat tissues, your bloodstream, your neck, your hair, wherever you can go. Now, on all of these cells that we distribute our glucose to, through the insulin being produced from the pancreatic beta cells, all of these cells have receptors. Now, this is the significance of the receptors. The receptors, when you put insulin there, insulin goes and binds to those receptors, telling those receptors. The routine of the receptor is that those receptors are going to identify if those are insulin or different things, because different receptors do different things. So it's going to say, okay, insulin. So insulin is going to create a cascade on the receptor for your cells to open so that glucose can come in. Now, funny thing about glucose, plenty of things can happen with glucose, right? But one of the things I like about glucose is, I know Sis Facia, when she hear about this, she'll be very excited, is energy. When you take in and goes to all of your cells, glucose is distributed all of your cells, you have equal level of energy. Somebody that Professor Peter would say ATP, and the B word is scientific volume, adjoining triphosphate, meaning energy level goes up. Now, you see why when somebody have diabetes, their glucose is stuck where they eat, is sitting there. Insulin is not picking it up because they are insulin resistant. That's why your doctor will always say you are insulin resistant, meaning the insulin are supposed to take up the glucose and take it into the other part of the body. Those receptors are damaged, or those receptors are not responding. So because they are not responding now, the food you ate, the tteokbokki, were just sitting there. It's building up. It's just sitting there. Insulin is not opening a receptor cascade for them to go to all part of the body. Right there, you have low energy. That's one of the characteristics of those that have diabetes. They say your energy level is very low, or those that are pre-diabetic. So definitely, you understand how important is it for your insulin to work. That's the reason why they put you on insulin therapy when your insulin are not working. You are insulin resistant. That's normally happening with people with type 2 diabetes. And type 2 diabetes happens in elderly people. That's why I'm discussing type 2 diabetes, because we're talking about the young adolescents, we're talking about type 1 diabetes. But we're talking about type 2 diabetes because that's what is happening with you. Now, I will try to a little bit lodge away from the explanation because I explained extensively, but something I would like to dive into is that even though the receptor has issues, what happens is, I want for you to know why diabetes is a complicated disease with other organs, because all of these organs need this glucose to go for your energy, for them to function. So a very big example is that the glucose is sitting there. Your insulin is not taking it and transporting it through the receptor, going to other part of the body. When they sit there for long, says Facia, Professor Piri, then the glucose start to cause infection. Some of the infection is that the ghosts diverge or relocated into the kidney. Now, we started from normal digestive tract, now picking it up, going to the kidney. What happens is when glucose is a solid molecule, which is a salt, they are salt. So they attract hydrolysis, they attract water. So now they go to the kidney. The kidney is an area of waste. It carry water along hydrolysis, and then somebody with diabetes start peeing fast because now it's in your kidney. It go to another organ. It causing too many problems there. You peeing every minute or second. Too much pee with sugar in the water can cause infections, other infections, the UTI, urinary infection, something. So in Africa, people don't have normal diabetes tests, right? So what they do, they say go pee ulcer. I remember in Liberia we used to do that. Go pee ulcer. Then when you pee ulcer, after a while, the ants will come because ants like sugar. When the ants come around, they say that you diabetic. It could be different thing. But
So
that
true. So true.
it could be something different. So because doctors don't have the instrument, they make that kind of we call it hypothesis guess, right? That you get diabetes. You could not have it may not be diabetes, but that's just a hypothesis guess because it's not scientific. So now your kidney is overworking. So we get what we call polyuria. Yeah, glycosuria, glucose in your urine. Then a little while, polyuria, plenty PP. Now, when you start peeing too much, then you get what? You get dehydrated. You're losing a lot of electrolytes and water. Then what happens? You start feeling thirsty. That's one of the symptoms of people that have diabetes. Then they want to drink all the time because you're peeing too much and you're feeling thirsty. Then the neurological effect of that is that it goes to your brain until you say, I want to eat. I want to eat, and you need more food. Now the insulin that's supposed to take the glucose to other part of the body is depleted. Those receptors are now functional. So then what happening to you now? You eating, you drinking, but as more you eating, glucose is still sitting there and going other part of the body and then going to liver. When you go to the liver, they go into what we call glycogenolysis or lipolysis. Too many fat in the liver, your body start getting fat, obesity, and other things because what's supposed to be functioning is malfunctioning. So I decided to give that brief overview because now you understand now when you have diabetes and they say you are insulin resistant, that's what happening to you. Those receptors are now communicating with their insulin for them to, so in order for us to make those receptors functional. Funny thing also, now if you have so many glucose sitting there, then what happening also? You're overworking your insulin. So that why we need to give you insulin so it can aid and abate the ones that you already have in your internal organ. So let's look at the signs and symptoms of diabetes. Polyuria, we talk about it. Plenty PP. Why you peeing? Polydipsia. Polyuria, which is glycosuria. Yeah. So you have one of the things is dehydration. We talk about it. Fluid depletion, electrolyte depletion. We talk about it. You have weight loss, loss of blood tissue, water. You peeing, putting out water all the time. You have poor energy utilization. You can't utilize energy because glucose is stored in the form of energy through ATP. Then you have skin and other infections, which is hyperglycemia. And then we have blurry vision because there's something we call osmotic changes that happen, imbalance that cause blurry visions. So all of these are common signs and symptoms of diabetes. Now, what are some complications that can happen with diabetes? Briefly, skin infections. We'll talk about it. Your bone formation can be decreased, which increase the risk of bone fracture. The digestive system, you eat the food all of the time, but you're going to suffer from what we call the pro-inflammatory cytokine release. I don't want to go into that because every time you eat food, those are cytokines that accept them. So you keep adding glucose there, but then your digestive tract is not actually digesting or metabolizing all of the food. Your skeletal muscle now receiving electrolytes, no iron, calcium, potassium, all of them not enough because this thing comes through food. Then you start having kidney issue. I will talk about too much urine, peeing. Then you start having cardiovascular issues because the blood supposed to flow efficiently with certain oxygen, certain ingredients. It's not happening. So you start having circulatory exchange of tissues. You start having immune systems defect The simple implication, what of the immune system defect is that the aspect of the beta cells can cause that. Adipose tissues, fat, your brain nervous system, overworking, I need to eat. So something we call neuropathy, nervepathy. All of these are complications with diabetes. That's why diabetes is an essential disease. You see, those are in research and development, especially a lot of you guys know Eli Lilly and company, they are big into insulin production because diabetes is a serious kind of disease. So those that are into research and development are more into diabetes research, cancer research. These are things that happen so many times that scientists, clinicians, nurses, all of them are working together to make sure they can handle or have full control over the prevalence of the disease. Now, I'll go into type 1, type 2, type 3, type 4 diabetes very quickly. Why is it? So for type 1 diabetes, we often refer to it as juvenile diabetes, which is children diabetes or for young people. What happens is when your body's own immune system destroys the insulin producing cells of the pancreas beta cells, which produce insulin. So we already talk about beta cells, right? But for type 1 diabetes, it's your own body that destroys your insulin. It almost sounds like autoimmune diseases. The rheumatoid arthritis and other myasthenia gravis, all those autoimmune diseases. Meaning, when it's autoimmune, your body is fighting against yourself. So most times people will say, "Oh, type 1 diabetes is autoimmune." So your own body is the one that destroying your insulin. That can be so many things that cause it. Some of the things could be genetics, family background, virus, other environmental trickles, or you are predisposed to diabetes, something like that. But only 5% of people have this kind of type 1 diabetes. Because when you're in your younger age, since Fasia, too many things. Even if you are predisposed to type 1 diabetes, you are active, you are working out, you are going to school, you are doing so many things at the same time. So, at most, the rate of people that have type 1 diabetes won't be so much because you are burning it, like you said, through exercise. You are working out, so you will not notice that. But there's no primary intervention at most. So your body does not produce that insulin because your body is fighting against the insulin. That's autoimmune characteristics.
Jeremiah, you got a question.
Okay.
Do you want to take question while you're going, or you want to complete before you answer questions?
It level you guys, how you think I can do it?
Well, because you're on the point that the person is asking the question about, so not to take you off track, you could just expand into it and keep going. Her question is, can type 2 diabetes be reversed without medication, but with lifestyle change and diet? From Leah.
I would say, okay, thank you, Madam Professor Piri. And sorry that I interrupt you. At most, I would love for you to read the whole question, but I interrupted you. So sorry. So I didn't get the last part.
She said, can type 2 diabetes be reversed without medication, but with lifestyle change and diet?
Yes.
Yes.
Okay. You can answer.
Yes, I can elaborate on that. Yes.
Okay, sure.
Diabetes can be reversed if, with diet and exercise. If you lose weight, I have a lot of patients that, have watched their diet, they have lost weight, and they have reversed it. So the answer to the question is yes.
Leah, your answer is yes.
Thank you. And since Fasia answer it,
and we're talking about type 2.
Yes.
We're on type 2. Okay.
Yes.
Yeah.
Yes, since Fasia answer it right, so I will just proceed with my communication since she already answered, and no better answer can be than that. So, with type 2 diabetes is most common form of diabetes, very common. About 90% of the cases happens with adult. So people normally say it's called adult onset non-insulin dependent diabetes. Your body produces insulin, but does not use it properly or appropriately for the right cause. So your glucose does not enter your cells. We have already discussed that. So that's type 2 diabetes. So you know the difference now between type 1 and type 2. Type 1, your body fighting against your insulin. Type 2, those insulin are produced rapidly, but the receptor, they are not taking it, they're not able to take the glucose into your cells. So that's the differences. And type 2 is more common in happening elderly people above 30s. That's fine. You start slowing down lab activities, you eat toboggi, you eat double cheeseburger, you eat padanyam, you go sleep. You come from work, some people sit on the computer all day at work, drive, come home, eat toboggi, like me, 12 minutes, eat toboggi before go to bed. Now, the glucose is sitting there, insulin is not working, receptor is malfunctional. That's type 2 diabetes. Now, let's just briefly, thank you, Mr. Logan. Let's just briefly go into what we call latent autoimmune diabetes of adult. This is not common, so I'm not going to waste my time on it. Just in case you hear it somewhere. This is, some people call it 1.5 diabetes. This is autoimmune also, but it gradually attacks the pancreatic beta cell, eventually leading to insulin dependence. This happens between 30 years and older. But with this type of diabetes, it is positive for at least 1 or 4 of the antibodies commonly in type 1 diabetes. So there are other antibodies we're going to also come. We don't want to discuss. But for this is what I want for you to get to from this. It's not treated with insulin within your first 6 months. So when they say, oh, you have latent autoimmune, they're not going to treat you with any insulin within the first 6 months after diagnosis. Because what happens is there's an antibody positive adult repair system that they have to observe. They have to continually observe you because it's 1.5. It could be type 1 and be mistaken as latent. It's autoimmune, but the main thing is few antibody is one are causing that. So that is observational before they can go into treating you with any therapy, insulin therapy. Says Fasia, how you pronounce gestational, right?
Yes, it is gestational. Gestational diabetes.
Gestational. Yeah, gestational diabetes. I'm not familiar with this, but this is for pregnant women.
You know, I love that you ask, how to pronounce it. Hey,
Oh yeah,
that's good. You there's always room for knowledge. So
exactly,
I love that.
exactly.
We don't know
Exactly.
it all.
I like type 2 diabetes in type 1. So gestational diabetes, I never dive into it extensively. So reading about it now, like I need to get the word correct. So
let me just add on to that gestational diabetes,
okay,
and you can elaborate. So
definitely
this is the
you can do that.
diabetes that you will get during pregnancy.
Yes,
But one thing I want people to know is one of the risk factor is if you have a baby 10 pounds or more, your risk for developing type 2 diabetes in the future is very, very high. So I just wanted to add that little tidbit, and then you can continue.
And you know that's funny, just to come in there, because
Mhm.
woman is pregnant, we have a different kind of test we do to check that sugar level just because of this gestational diabetes. And most times, some of the people who will have it during pregnancy do not consider themselves diabetic. After the baby is born, your body looks like it's abnormal, but watch that risk factor.
Definitely, yes. Now there are chances that you will not get diabetes in the near future,
Yep.
but one of the risk factors that I tell my patients, and statistics have shown it and it's evidence-based, is that if you have a baby 10 pounds or higher, your risk for developing type 2 diabetes in the near future is very, very high.
Definitely. And I won't go into much because exactly what I have here is what you guys talk about. So you guys are in that area. You guys had kids before. I can't do more than that. That's just a little information I had, and you guys not even looking at my slide. You say exactly. So I don't know if you have a
Well,
microscopic eye to
hey,
look
this
at
is the
So
provider speaking now. This is not just Fasia speaking. This is Fasia, the provider, speaking.
exactly. So I'm not going to that. Only thing I'm going to say that according to statistics, 18 every 100 pregnant women may suffer from that. That's what I have to say, and that's what I'm going to say. You guys are explaining everything, and I'm not going to dive into that. Just going to proceed.
Yeah.
So now, well, let's look at the normal blood glucose, your fasting blood glucose. What you want, because some people have the glucose, the blood glucose test at their home, or they see the doctor doing it, they don't know. So you want your normal fasting blood glucose to be less than 100. Now, randomly, if you just take your blood glucose, if it's less than 140, and your A1C, which is your, we call it hemoglobin level, your 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 hemoglobin glucose level, I'll just consider
Yeah.
that sugar level.
Hemoglobin
Yes,
C.
yeah, which is your A1C. You want it to be less than 5.7%. That's a normal. That's normal. Now, when you pre-diabetic, interestingly, I took my kids to the doctor visit this morning, and since Fasia, I told the woman to check my glucose, or my kids' doctor to check, and they say I'm pre-diabetic. So the range is 100 to 125, but I'm at 119. So what is it telling me? I think I'm playing soccer every day, so I'm fine, right? So it's telling me, okay, but when I go, further looking at other posted Jeremiah can play, but his energy level low. So that could be one of the reasons why my energy level low. Why you telling me work out,
Exactly.
manage diet,
Yes.
stop eating tteokbokki too much at 12
Slow
minutes.
down,
I always do.
Tabaki. Slow down.
La vieille pose to back and kill anything.
So that's why this topic is so educational, because you don't know how much you are affected. I'm in the middle right now. I could get worse, I could get better, depending on the approach I take. So lifestyle modification is important at this point for me. And when you pre-diabetic, your A1C is going to be between 5.7 to 6.4%.
Yep.
So it tells me that 50% of my pancreas is working right now. The other
Yes.
50% just japping me. They just japping me. If I blunder, everything messed up, then my insulin can't transport glucose again. Then I become type 2. Right there. I use myself as
And
a
you know
scenario so that you can
that's
get it
very
clearly.
scary, because, like we were saying at the beginning of the show, 37 million Americans has diabetes, type 2 diabetes, okay, or diabetes.
Yeah. Yeah.
But 90 million are pre-diabetic. That is
Yes.
an astounding number,
Very much.
and
Very
it's scary.
much. It's very scary.
And so
And
it is a fine
sadly-
line for you to slip from pre-diabetic
Uh-huh.
into diabetes.
Yeah.
Yes.
And
Yes.
it's sad because it's like all the industries are now working together. FDA is not regulating nothing,
Mm-hmm.
but they want to make sure that we pay insurance, and insurance just waiting back for you to keep paying in. They keep collecting. I mean, to me, it's just a big old money making scheme.
It
You
is.
make bad food, the people eat it, they get sick, you get the money back, you get. It's just. So if people
Well,
don't get the education
you know,
to
as
act right,
a devil's advocate, yes, it's money making, but you have control over your body.
Yes.
You have control over what you put in your mouth.
Yes.
You have control over, instead of sitting down at home every day, you can get up in the evening and go and walk.
and go
Yes.
walk. Yep.
Yes.
Stop eating all that tabagi.
And use the resources you have. Use the gym. Walk around your neighborhood.
Exactly,
Do
yes.
something.
And
Do
that's
something.
why we are empowering you all today. Because
Exactly.
this is serious. Don't take it lightly. Oh, me, I just eat my leg, rest, I sit at home, I can't go in nobody way. You're looking for your trouble. Keep being in your house and
So
eating
true.
the rice. You
That's
see?
you. That's
You
you.
know?
And you know, our ethnicity puts us at risk.
Yes.
Yeah.
You know?
African American.
Yeah.
Yes, it put us at risk.
And trust me, diabetes don't just come by itself. It like it causing, it will hit the heart, it will hit the kidneys.
Everything,
before you
every
know,
organ
those
in your
are
body.
boys.
Your bone, everything.
Dear.
So when you check your fasting blood glucose and it's around 126 plus and randomly 200 plus, it tells you that you're diabetic. You don't want to hit that number, my people. You're listening to us. We're telling you guys, you don't want to hit 126, because at the stage you are, if you can manage your lifestyle, like the host said, it tells us that, look, you will not go through all of the complication. You will not have heart problem. You will not have nerve problem. You won't have bone problem. You won't have kidney problem. You won't have liver problem. So at this
Even your
present
eyes,
movement,
even your sight, you
yes,
go blind.
yes,
yeah.
blindness, everything.
Retinopathy.
Exactly. So there's the best time to take it very seriously. I will advise young people, though we exercise, try when you go at least 2 times a year, check your glucose, check your blood sugar level. When you go to your doctor visit, just ask them randomly like I did today. It led with me now to take my working out seriously. So you do the same. You don't want to hit that number because since fascia, when you hit that number, it gets more complicated to go back. You gotta work hard to get it back, bro.
True. Very true.
But
Yes.
do it now so that you can think about it. So that's my honest advice. I will already talk about the complication of diabetes. Like since fascia, I said these women looking into my slots big time. They look into my slots. She talk about blindness and all. So I'm just keeping that slot, and we already discussed normal blood glucose. But what I want to say is there's something that I would like to be specific. Fasting blood glucose is different from post-meal blood glucose. And maybe Sis Fascia or Madam Peter will want to just talk about fasting blood glucose and post-meal blood glucose level because one is before eating, one is after eating.
Yep.
So your fasting blood sugar is, like it says, you have to be fasting for 12 hours and then we'll take your blood sugar. So
Exactly.
these are ways that we diagnose diabetes. Now, in order for us to say you are a diabetic, your fasting blood sugar has to be 126 on 2 consecutive times.
Yeah.
So if I did your fasting blood sugar today and it's 126, I will say come back. In a couple of weeks, I will recheck your blood sugar, and then if it is still 126 or higher, I can diagnose you as a diabetic. Or if your A1C is 6.5 or higher today, I can diagnose you with diabetes.
Thank you.
So those are the 2 ways that we can diagnose with diabetes. And then the postprandial or the post-meal is after you've eaten, if it's 200 or higher.
Exactly.
So just remember this. Jeremiah talk about how the food you eat, when it's broken down, is used for energy. So now when you're fasting, that means you didn't put no food there. And your numbers already up. You're in the red zone. If you're fasting, your sugar high, we are in trouble. Just imagine what would it be like when the food actually enters your body and doesn't have a way to get to the cell. Now they're just passing around, wreaking havoc. And because sugar, when you think sugar, think about the sugar when you put it in the pot and melt it. Just how you see that melted sugar, that's exactly how it is in the bloodstream. And because you have small, tiny vessels, they can clog it up. They go all the way to the end of the capillaries. And they sit there, nothing goes beyond the sugar point. It's called sugar stop. Then you start having less sensation. You start having tingling. You start having numbness. All because sugar has now have no place to go. And they just say, look, let's just go walk around. Since there's no insulin to pick us up, we're just going to take a walk. When they take a walk, it's a problem.
Exactly. And so my sisters are already said it best. So I will just go into preventions and therapy, and then we can have time.
Hey, Jeremiah, let me just elaborate on that sugar in your bloodstream.
Okay.
The way I explain it to my patient, I try to find ways that the layman can understand when I'm explaining to my patients. So when your sugar is high in your bloodstream, the example I give them is if you take sugar water, right? And if the sugar is high in your blood and you take that blood and drop it down, after a couple of minutes, you take your finger and tap it, it's going to get sticky. Okay? So when your sugar is very high and it's not controlled, you run the risk of stroke because you can have blood clots. So there's so many facets that diabetes can affect.
So many.
And because, like high blood pressure, they don't see it until you check your blood sugar, but some people are non-compliant. And most people are non-compliant. They say, because I have to stick my finger. I mean, technology is here now that you don't even have to stick your finger no more. But you have to do your due diligence and check your sugar and be compliant with your medications. Because if your sugar is very high, you are going to run the risk of blood clots, and you're going to run the risk of stroke as well.
Yep.
So now let's look at prevention of diabetes. We already talk about exercise and more prevention, but let's look at type 1 diabetes, how you can prevent it. At most, because it's autoimmune, sometimes your body is fighting your pancreatic beta cells. So it's not something that's easily prevented. Now, there's an increased study in the scientific society now that is conducted by Martin Hassana, Dr. Martin Hassana from the Medical College in Wisconsin. What he's doing is that he's trying to remodify the specific beta cells. What he's doing is he's trying to find possible way to prevent the destruction of your beta cells. So what he's trying to do is, okay, since we want to prevent type 1 diabetes is very difficult, and the issue is the pancreatic beta cells, my research is going to see that how we can prevent the pancreatic beta cells from destroying, for our body destroying them. So he's conducting a research on that. Another thing you could do in the meantime is to maintain and control your sugar level. Sometimes they give people insulin injections early to prevent it, and then healthy lifestyle like exercise and diet. We can't emphasize this. Also, they're doing what we call islet transportation. What is islet? The cells that are within the pancreatic beta cells, they try to do transplantation of it. So they do something about infusion, like how you call it, injections or a transfusion. It's a form of surgery they do. So all of these are just way to help people, but you don't want to go through that. So you want to do the easier way. Secondly, type 2 diabetes can be prevented. The primary way is lifestyle medication, nothing else. Primary. Secondary is to check your A1C regularly, adjust your diet. But primary is to maintain your healthy lifestyle for type 2 diabetes. And that's why it is very important with diet when it comes to type 2 diabetes. Tertiary, just exercise and eat well. Sometimes people do foot exam because people know about the diabetic foot exam, where when they put a little tray on your feet, your feet is so numb you can't feed it. So sometimes they do the diabetic foot exams. So all of these are very important. But the key thing to this is that, okay, I'm type 2 diabetic, I'm going to exercise and manage my diet. If you don't take anything from our topic today, I will encourage you to take lifestyle modification important. Because one thing about us, we don't know. So when doctor give us therapy, we just depend on the therapy and think the therapy will solve everything. But you're going to be on that therapy for your whole life. So why not exercise and reduce? Because you can live from being type 2 diabetic to pre-diabetic and non-diabetic, depending on the work you put in. So for a gestational diabetes, the same thing, physical activity, but because people are pregnant, they won't do much physical activity. Study shows that at least each 10 grams of fiber every day of food is important. Meaning, just avoid glucose, sucrose, large activities, and eat more fiber, eat more grains, eat broccoli, eat cabbage. Those are very much important when you are pregnant, because, like my sister said, when the baby is greater than 10 pounds, forget it. It doesn't mean you're going to have type 2, but you most likely will end up with type 2 diabetes. Because one of the things is to reduce the baby fat, it takes time for some people, and you're not exercising. So that's a serious problem right there for you to get type 2 diabetes. Let's look at pharmacological therapy. What are therapy normally giving? When somebody has type 1 diabetes, normally people start lifestyle modification. Most of these therapies comes in line with non-pharmacological therapy, meaning lifestyle modification. Even though you own medicine, lifestyle medication, the combination help to reduce the outcome or lower the chances of death, because diabetes can lead to death, lead to blindness, lead to so many things. So lifestyle modification, check your normal glucose, and when you have type 1 diabetes, they normally start with insulin. Now, insulin, it has its pros and cons. I did not dive into the side effect. I'm not here to scare people or anything. I didn't go into the side effects. But You can gain weight when you keep taking insulin. We all know that. It can make you hyperglycemic or hypoglycemic, meaning high sugar level, high glucose level, low glucose level, either or depending how it is given to you. So it is significant for you to, as much as on therapy, look at other side effects that may happen. Now with type 2 diabetes, most times they start with metformin, our basic type 2 diabetes medication, for which I will not dive into other things. Other things can be given like how you call it, Genevia, other medications like how you call Invokana, all of those medications. I'm not going to go there because their classes are so complicated. No. I'm just going to stay on the basic one like metformin. Metformin is given regularly. I think normally they start with 500 milligrams per day, 6-5 if I'm correct.
Yes.
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 Per
And
day.
let me just elaborate on metformin. Metformin is such a great drug. Okay.
Very good.
And one of the things I want to specify about metformin is that it does not it does not drop your blood sugar. It keeps it at an even keel. It keeps it at an even level. So you most times you don't run the risk of being hypoglycemic or your blood sugar running low blood sugar. And number
Exactly.
two, metformin also helps you with weight loss. It helps my
Really?
patients with weight loss. So
That's
it
good.
is such a great medication. And it can, if you take it as prescribed and you watch your diet, you can eat. If you're a pre-diabetic and your doctor puts you on metformin, you can drop your A1C from 5.7 or 6.4. You can drop it to 4, and that takes you out of the
Exactly.
pre-diabetic.
Exactly.
So for you, Jeremiah, with your sugar, you being a pre-diabetic, what was your A1C? 5.7?
Mm-hmm.
Okay,
It was
so
around that.
you don't need the medicine. But if the person is like 6.3 and they watch their diet and their doctor, especially if they're overweight, if their doctor put them on metformin,
Mm-hmm.
you can bring yourself from a pre-diabetic to a non-diabetic, and you can lose
Yes.
weight. Because one of the
Exactly.
things is, if you diagnose a person, it is very hard to expunge a diagnosis.
Mm-hmm.
When you put that diagnosis on a person, the
It's
insurance
yours.
it's gone. So to remove it's hard. You cannot expunge it.
Yep.
So that's why I'm very careful as to how and when I put that diagnosis on a patient. If I check them and I see that they are pre-diabetic, I try to work with them, because once you hit that diabetes, that's it.
Exactly. Exactly. So that's it. We start at metformin. One of the things I just want for you to know is that another advantage of metformin is that from the pharmacy standpoint of view is less costly. Most people insurance cover it compared to other therapy. So it's doable for you to pay for it. It helps with your weight loss.
Mhm.
It also reduce your A1C. And one thing, it does not increase your risk of hypoglycemia. You may,
No,
to,
not at
yeah,
all.
it don't. As she said, it keep it to that normal stability.
Yes.
So that's why make it's a champion medication, And also sometimes for type 2 diabetes, they also use these insulins. Now they get different type of insulin, long-acting insulin. They give it to you. It goes for a long period of time. Bolus for them to have it stable right now, and then they have the one for short-acting. So based on the condition, the doctor tell you where and which of the insulin he's going to give you, either bolus, either basal, or either long-acting, whatever it could be. Now, before I finish, somebody will ask, but what are some of you guys' contribution with this whole thing? I've contributed as an individual and with a team when it comes to diabetes. I think you guys, since you guys know about the new diabetes medication, Monjaro,
Yes.
Trazepita,
Yep.
big. Right now, that's a training drugs on the market, FDA approved. And FDA is about to approve that for weight loss as well, almost like metformin.
Yes.
Now, personally, I contributed to that to do the peptide separation, the filtration chemistry at Lady. And our research got published because there's a new job in our pipeline and in our protocol, in our portfolio that we call the Triple G, that is going to be a champion medication that is not out there yet. So there are a lot of clinicians, nurses, everybody working together in clinical trials to make sure that by 2050, 35% of the population in the United States do not be affected by diabetes. But as much they are doing their medical part, they are doing their science part, they are doing the nurses part, it is up to you to do your own individual part. And that
So
is
true.
to maintain a healthy lifestyle. You make it easier on yourself and on society. So thank you very much. I want to say thank you to the host for giving me the opportunity to contribute my quota when it comes to diabetes and to be part of this the educational series. This is very educative for our community, for our society, and I want to also tell them
Indeed.
thank you publicly for what they are doing, taking the time every Friday to come with one disease state, two disease states, and talk about it. People are learning. So I want to say thank you very much to Sis Fasia and Professor Pele. And I will be on if somebody have a question or if you guys just want for us to talk randomly. But other than that, thank you very much again for having me here as your studio guest today.
Thank you
Wow.
so much,
Wow.
Jeremiah.
Wow.
You did a
I
fantastic
mean, you
job.
made our job easy. Thank you,
Yeah,
thank you, thank you.
yeah.
I learned something from this as well, and I'm gonna go back and rewatch this, and I will be able to better help my patients as well. So thank you, thank you, thank you so much
Thank
But
you
you
for
know,
very
coming
much.
Jeremiah,
on.
I got one question because you're more on the pharmacist side. I want you to tell me what you think.
Okay.
Most time when we have hormonal problem,
Mm-hmm.
we give the hormone therapy.
Mm-hmm.
Why is it that with diabetes, we go through an algorithm to start with metformin instead of going to insulin?
Now, the thing is, with we're looking at the clinical implications in general, right?
Mm-hmm.
When you're looking at hormone therapy, there are a lot of things can occur when it comes to hormonal therapy. It could be your testosterone, it could be your estrogen, it could be so many hormones.
Mm-hmm.
You have to identify which hormones is having a serious problem.
Mm.
And then when you're giving a hormone therapy, they are normally dual therapy or triple therapy, 2 or 3 therapy. So doctor don't want to go into such complication. So they go straight into metformin because what metformin do is metformin target the serious problem. What's the problem here? The problem is with insulin. The problem with our pancreas beta cells. Okay, we are going there specifically for that, and we're going to manage it. That's the reason why metformin is a drug as an equilibrium, it at that equilibrium level, it balances it out, it keep it there. Because we know that with diabetes, yes, there are some hormonal effects, but are those hormonal effects more risky than managing your insulin and your pancreatic beta cells? No. So let's focus on a pancreatic beta cells than to focus on the hormonal therapy. That's the reason from the pharmacy standard, because when you do therapy and you managing therapy, it's highly significant that you go for the major cause and forget about other cause. And with diabetes, so many cause. I will give you one of the example, one of the challenges I had with one patient diabetic or diabetes patient, just because you mentioned hormonal therapy, right?
Mm.
I think you heard about patients that are diabetic polyneuropathy, right?
Mm-hmm.
They have so many complications. Their
Yeah.
diabetes get their nerve so many states, right? And it put them into depression.
Yep.
Now we have to look at so many things for that patient. So then we have to say, okay, though we're treating them with metformin, we need a dual therapy. Then we say, okay, let's put in SGLT2. And then when we do that, we have to look at the glomerular filtration rate. Then when we do that, then we start looking at, okay, he's in the depression. Which better drug we can give for depression? Then we say, okay, let's give SNRI, duloxetine, because it helps with his pain, at the same time help with his depression. You see the complication with that kind of patients? So every patient is different. So that's
But
the reason most
do
people.
you think when the patient started showing signs or ineffective production of insulin. If you would have started giving insulin to them, would you have rectified it, or to go through the algorithm until they lose their legs, then you start giving them insulin?
Well, let me
Yeah.
let me just step into that,
Okay.
Professor.
Okay.
With type 2, we cannot just go to insulin because the pancreas is creating insulin. It is just not letting all of the insulin out. Okay, so you for the most part, they don't need insulin. Now, for the most part, I won't start the patient on insulin. Even if they're type 2, I won't start them on insulin unless if the A1C goes up to 9 or higher.
Yes.
Then that's when we will start insulin. So yes, we have to follow that algorithm.
Yes.
Because
since
you just don't want to jumpstart and start the patient on insulin. No.
And since Pasia, this is another reason you could not just start insulin, right? Because the way insulin transport through the glut, just in the liver, they use the GLUT2, right? There's the reason why I won't start insulin even in that case. There's the reason, because if you get insulin is already in your body, you're getting more insulin.
Insulin, yeah.
With more insulin, you have less receptor.
True.
Because each of the insulin have to, that's the scientific part now. That's just scientific now. You have too many receptors, but you have, let's say you have 1,000 insulin already, then you only have 50 receptor. So 50 of those insulin bound, you have 50 more insulin floating.
Exactly. Yes.
So you're making more insulin, but less receptor, and those receptors have to start overworking because they have to open up those cells to start going in. So guess what? You're getting more insulin than what you need. Your body can only take more homeostasis, balance. So that's the reason we won't start with insulin. You will go with metformin.
Because a lot of patients have a lot of concerns. Some people just don't want to stick themselves anyway. But they get, and the doctors sometimes they use it like a threat. If you don't take care of yourself, I'll put you on insulin.
No. It sounds as a threat, but it's not. It is a fact. If you do not, it is a fact.
The way you say it to the patient is what scares them. Oh, my doctor said they're going to.
But you have to. You have to. If I have a patient that is non-compliant, I have to be straight up with you.
Exactly.
Hey,
that's the problem.
If you don't take your medicine, if you're not compliant with your diet and exercise, you run the risk of sticking yourself every day with insulin. If not, you're going to lose your leg. You're going to lose your eyesight. You have to be blunt.
Yes. Yes.
You know, I tell my patients, there are three people.
Patient. So
now,
it
is a way.
What happens is when it's get to that point and the patient has to take insulin, they don't want to go there because they remember my doctor said it's bad if I put you on insulin. So now they don't want to take the insulin when they are bad.
So would you not want me to be honest with you and tell you what's going to happen in the future if you don't comply? You just want me to sugarcoat it and say, oh, if you don't take your medicine, that's fine. You know, you can come back to me every 2 weeks or every 3 months, what have you. No, that's not what I'm here for.
I don't think there's any way you can sugarcoat diabetes. Already sugar.
No, exactly.
Yeah, to deal with these patients that are not compliant is very difficult because the reason doctor gets created at them with diabetes, this is the funny thing. The doctor already have in his mind that this patient will go into renal issues. And to those renal patients, it's even complicated because think that SGLT2 will just make you peep a lot medication in those classes, and then we have to keep checking your EGF factor. We have to keep checking your kidney every time you come to the hospital. So the doctor tell you, look, if you don't do this, you get on insulin. You don't want it all the time. So stay with this. Sometimes that it sounds fearful, but that tell patients I don't want to get worse because if I get worse, I will get the most rough therapy. Yes. So sometimes being blunt to them is the only way out. Trust me.
So true.
So you're overlook today, you're hearing this with questions to help you, things you think about, and you wondered about why does it happen this way? Why? Listen, drink your moringa tea, get outside and walk. Leave that rice after 6
And cut
o'clock.
down
You're
on
going
that
to
cup of
bed,
tea.
you going to eat
Cut
rice.
down on that fufu and soup.
Ah.
True,
Cut down on
true.
that pampata.
The
Cut
lady
down
Yes,
on
too
that
said,
much.
cassava leaf.
she put the fufu in front of her and she eating it. She said, Lord, turn the fufu into salad. I said,
And since Fazia, the funny thing is, you notice, I don't know if you notice it in practice, you guys notice it in practice that most diabetic patients now are getting on starting therapy, right? The new guidelines are coming up.
Oh, I
They're
start all
treating
my
it.
patients on statin because that's a preventative.
Yeah,
I'll ask them and I will tell them I recommend I start all of my patients on all of my diabetic patients on statin
yeah,
because why I'm saving their heart that their cholesterol, their triglyceride is going to get high, and that's just preventative therapy and that's ADA guidelines.
somebody
yes,
say,
yes.
how? A hard is harder.
But it's necessary. It's very
In the other
important.
category.
It's very important because it helps. It saves life. It saves lives. To
It
be
does,
fair,
yes.
it is save life. Yeah, and our lab in America is very busy. It's
Oh my
sitting on computers, sitting home, sitting in a couch, watching TV. You don't know what's happening. Just sitting there and putting a lot of glucose and sugars in your body, and then coming down with other things. And the thing about diabetes that so complicated is that not that oh, I get arthritis, I can just take pain medication, my arthritis. No, 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 no.
This is a
It
lifetime
hits
thing.
everything
It's
it
in
not
your
a
will hit
body.
cage.
everybody.
Exactly.
You know,
Yes.
everything. If for Jeremiah, it may probably affect my heart, but for you, it may affect your eye. For
Yeah.
somebody, it may cause amputation. Everything can be, your entire system is coming down if you joke with it. Yeah.
Somebody said they like the pump, but don't eat man, eat it in portion size, small, small.
Small,
Don't eat it in one sitting.
small. Let it easily take
Put
the
on
first
the
one.
plate
You
and
pick
you
well,
bring
well.
out
Then you
the
take
spoon.
it. Yeah.
Well, we
Yeah,
are so
but thank you
thankful
so
today we
much,
had another
Jeremiah.
opportunity. Go
Yeah.
for
Thank you guys very much. Yeah. So I can go now, right?
yeah, thank you
Yes, yes,
so
you
much,
can. We'll
Jeremiah.
be
Thank
reaching out to you, Jeremiah. I think one something that just came to mind is,
Mm-hmm.
for men, this hormonal therapy that most bodybuilders they want to do the testosterone. There's a lot of risk factor with that. You talk
It's a
about
lot.
statin, it
It's a
raises your
lot.
triglycerides. So maybe that's something you can come and talk about later. You know,
I can do that. In fact, even if you do that bodybuilding supplement, if you take it over plus and your muscles cannot continue your electrolyte, will get something they call rhabdomyolysis. I think you have eight.
that's it.
It
Yeah.
break,
So
yeah,
maybe we
it
can we
happens
can
too.
we can talk about that. Down the line.
Yeah. Yeah, sure.
Okay.
Just let me know. I'm off the whole
it
month of
is life.
September.
You
All
So
right.
try
Thank you so
A,
much.
okay.
you look for
Thank you very
trouble.
much,
You
man.
try
All
B.
right. Thank you.
All right, thank you.
Thank you so much, Jeremiah.
Well,
Thank you.
folks, there you have it. Ladies, this is our infamous scientist, Mr. Jeremiah Saleh Senior, that has come, or is he Junior? I'm sorry if he's I think he's Junior. He
Well, he
has
would be the
come
senior, but any
and
try he have will be
explained
the next group.
diabetes explicitly. That you can understand. If you have any questions, feel free to let us know. If you have any other topics that you want us to discuss, feel free to let us know. But this was an in-depth education on diabetes.
I know. Thank you so much. Oh, we didn't get James to come on.
James, he said he's standing by. Let's see. Or should we let him come on and talk about his disease on a different
Yeah, on a different
day?
day because it's
Yeah,
already
because the time is
7:20.
far spent. Okay, I'll call him
Yeah,
and let him know that maybe we
yes,
can do it next week on the
yes,
second
and
half. Yes.
yeah, we can do the ad early and then start from there. But well,
Okay.
folks, this is how it came down. You get this information, use it wisely. Knowledge is power. Do not be ignorant of the fact. It doesn't change it. It just makes you suffer.
That's it.
Change your lifestyle. Change your lifestyle. Back when we used to walk everywhere, we had LEG2, that was license plate. Here we get car to even go to the store.
I'm
You get to
telling
the
you.
store, you want park in the nose of the supermarket. You don't even want to walk. Do something different with your life. Change it. You don't have to sit down and feeding that big bowl of rice in one sitting. You can do portion size. Small. You can eat 6 small meals a day.
Yes.
You will give your body a chance to break it down. You sit down and take one whole bowl. No, let me tell you how selfish the insulins can be. They can say, I'm calling off today. There's too much work over there. and all of them ain't coming nowhere. Before
That's
you know, you'll
true.
be stuck with all that sugar. All right. So it has been good, thank God.
It's fabulous.
And it doesn't matter what you're going through.
Or what you have been through.
Thank
Thank
God,
God.
it's
It's
fabulous.
fabulous.
Have a
Have a
good
great
evening.
weekend
You've got this
and good
knowledge.
night.
Go empower yourself. Thank you.
Thank you.